Welcome to this Crittenden Press webcast brought to you by Boyd Funeral Directors and Cremation Services and Farmers Bank and Trust in Marion. Boyd's has been in Salem, guys, since 1902, and Farmers Bank has been in Marion since 1899. So that's two very long, trusted, respected partners in our communities. I want to introduce my guests here today. Shane Whittington, who is a CEO of Livingston Hospital and Healthcare Services. And then we have Barry Chittenden, who is the chairman of the board of directors down at the hospital there in Salem. And they have had this week an incredible announcement with this alliance with Deaconess. And we want to talk, of course, we had a story in the Crittenden Press this week about that, but we want to go get a little further in depth on that, and we appreciate their time coming in. I guess let's start, if you don't mind, Shane Whittington. Take us through the evolution of what's happened. I guess, first of all, maybe just explain the partnership in brief. And, of course, if anyone's read the newspaper, they have some idea. But explain the partnership and then kind of the evolution of how this started and came about. People would love to hear that story.
All right, good deal. Chris, appreciate you having us, and do want to say thank you for the article you wrote in the paper, because it was a great article and really laid everything out about the affiliation that we've got. And really what we're calling this is an affiliation, a partnership with Deaconess out of Evansville. And the great thing about it being an affiliation, it's still going to be a local hospital. The decisions are going to be still made local with our great board. The local staff, all our staff are going to keep their job, their benefits. So we're not going to see a lot of changes. The big change is we're bringing a big partner to the table who has lots of resources that we can tap into and bring those resources to the residents of these communities.
Mm-hmm. Talk a little bit about, again, the evolution and where this thing was born. And, at this point, maybe you can talk a little bit about these the meetings that you have with the Brain Trust. And I know you have a great board down there. I was a little surprised when I got down to the news conference. I think I knew everyone on your board of directors, but I couldn't have told you. I knew Barry was a chairman, and I really didn't know anybody. Well, I knew Susan Alexander from Marion was on the board, but I couldn't have given you the names of any of those. But it turns out I knew most of those guys. But you got a good board. Take us through the process, and when you had this offer from Deaconess on the table, what was the reaction and how did it go?
Yeah. Well, I guess we'll step back just a little bit. Our board, they started looking to the future back in late summer, July. They knew we couldn't keep doing exactly what we were doing. Healthcare is tough in the rural community, and our medical staff's getting older. And so we started looking at the future and talked to a gentleman out of Philadelphia about some USDA funding, and kind of ran some numbers with him to see what the hospital could do on their own. So we were heading down that road, and in those discussions, he had done a couple of deals with Deaconess and some other facilities, and he called me one day and he kind of went through the process of what Deaconess had done at these other critical access hospitals. One of the CEOs I'd actually worked with about 10 or 12 years ago, her hospital had been through this, and I reached out to her to verify what he was saying was true. They were down to less than 2 days of cash on hand, and they just finished their fourth project, over $35 million. So after I talked to her, I got excited. I called Barry and kind of explained to him. I said, this is what I've heard. So we had a board meeting on Monday night. I asked Barry to come in, meet with these guys, and so they kind of told him the same thing of what Deaconess could do, the possibilities. And at the end of that discussion, I said, Barry, what do you want to tell the board? And he said, man, let's tell them all of it. Mm-hmm. And so we did it that night, and we have not looked back. I mean, from that day in July, our board got on board and knew. I think they felt like they had some opportunities in the past that doors had closed. They didn't know why, but they felt like when this opportunity was put in front of them, they wanted to make sure that they followed through, and they felt like this was best for the hospital and community.
So were there any tenuous moments where you were waiting for that other shoe to drop for the it's too good to be true type thing? But did you have any of those type of feelings? And
about after every discussion we had with them, it was
of course, you've got some pretty high-powered attorneys that take care of these kind of things, but you also have an ace in the hole on your board as well with Steve Williams, the former CEO of Norton. I know he's been invaluable to this process. and I'm sure you lean on him quite a bit.
Yeah, well, yes, definitely. Of course, Steve, he's the same age as my older sister, and I've known him all his life, all my life, and he's always never did forget where he came from. He still lives on his family farm down there when he's back down this way. And back through the years, we'd called Steve several times when we'd have problems, and he'd come down and try to help us through that, and even talked to Baptist and Lourdes a few times for us to try to help us get some other help, especially when Dr. Barnes was sick and Dr. Gavin was overseas. But when Steve retired, moved back, and he kind of was a consultant for us for 2 or 3 years, and the opportunity came for a board opening, and he agreed to do it, and he's been invaluable. His expertise and all this, and so he was pretty hesitant, and he talked to me about it after we first went to talking about it, and he couldn't understand why somebody like Deaconess would want to come down to Salem and get involved in healthcare with us down there. What's the gain from them? What are they going to gain from it? But after several meetings with them, and I'm going to tell you, they're some of the nicest people you'd ever sit down and talk to. I mean, they can talk just like we're doing. I mean, they're the kind of people, you'd think just like local people. And they've been as nice and explained things to us. And after seeing what they had to offer us and the things that they would help gain, and it just gives them a bigger footprint in Western Kentucky, and that's what they decided to do. They were getting, they were just kind of hung there in one area, and they needed to spread out a little bit, and that's what they decided to do. And we had a meeting in Evansville with them, and on the way back, Steve turned around to us and he said, "I got it." He said, "I understand what they're doing now," and he said the person or persons that came up with this, they're not paying them enough money because it's ingenious. And every time we try to figure out, well, maybe this ain't right or something, it would even be better than what we thought. And it's an alliance. It's unbelievable. And I still look back and think, are we really doing this? but it's there.
Of course, Deaconess is very much involved in the communities in southern Illinois and southern Indiana. But they're in Kentucky too. They're in Morganfield. They're in Madisonville, Henderson. I don't think I'm leaving anybody. But you guys now, from what they tell me, are the farthest of their affiliates now away from the main hospital there in Evansville. But it's still a pretty close drive. And if you have to put somebody on that chopper, you can get them there in a hurry, can't you?
Yeah, and we use them pretty much for all our trauma. Probably 90% of our trauma goes to Evansville, so I kind of already had a referral pattern up there. So
yeah, Dr. Barnes mentioned that at the news conference, and of course I think they do here at Crittenden Hospital as well. Just a really respected Deaconess Hospital, a trauma level 2 trauma center, and very good hospital. Barry, I want to kind of fill you out on this. This is, I assume, pretty blockbuster news down around Hampton and Joy and all around Tylene. And of course, it is in Marion here as well. You've been a businessman, a farmer, and had your finger on the pulse of that community down there for ages. Not that you're an old man, but very seasoned. But what's the pulse? I mean, what kind of reaction are you getting when you're out in the community now the last couple of days?
Well, they're just, of course, I talked to a lot of people, but the ones I have talked to are excited because they were kind of like we were on the board. I mean, everybody could see the writing on the wall. If some things happened the wrong way, it puts you in a real bad bind, and we had been there before. But it was just almost like it was an ease for them. It gave them an ease that now there will be health care close. If something emergency happens, they need to get to a hospital quick, it's going to be there. It's going to be 24/7. It's going to be if someone gets sick or something and can't be at the hospital like Dr. Barnes did back a few years ago, there'll be someone there to see them and take care of them. And with this affiliation, that's what it's going to mean. And when they brought in the Madisonville Deaconess Baptist connection with us, and they really, that is pretty close, and they have lots of doctors flowing through there that they can spread out in the communities like us and over in Illinois. It's not that far for their other hospital, and so the way this thing should all unfold in the future, and the way they hope it will, is it will be a kind of, there'll be a surgeon that might want to work 2 days at us, 2 days somewhere else, and specialists will be down here, and we'll be doing cancer treatments, chemo. We'll be doing infusions, and they'll train all our new employees or our employees to do this type of stuff, and it's really going to make a big difference in the community, and that's what the community really, when they hear that, they're just really excited.
Sure.
Because if you got to drive from Salem or Joy to Paducah to get a cancer treatment, and you're not feeling good anyway, and you feel worse on the way back, well, you can go 10 minutes and get it, and then go back home.
And it is a challenge for some people to get a ride.
Exactly.
I know there are a lot of the churches who carry people for their treatments that have to go for long trips. But I think Dr. Barnes did sum it up just kind of like you did too. He said, the beauty of this, I can't remember the exact language that he used, but the gist of it was, there will continue to be health care in Livingston County for my children and my grandchildren.
Exactly.
Because of this alliance. And hats off to everybody down there that helped put this together. And I do want to mention too, one of your board members is Andy Fox, who is of course the funeral director at Boyd's Funeral Home down in Salem. Boyd's Funeral Directors and Cremation Services, and appreciate all Andy does for the communities around here. Really, he's a star of Salem, and you have a lot of those guys down there. I also want to thank Farmers Bank and Trust Company in Marion and Salem. They have had a presence there in Salem for quite a number of years, going on 10 years maybe, Barry?
At least, yeah.
Yeah,
Mm-hmm.
something to that effect, and we appreciate them. They're wonderful partners in the communities as well. Let's talk just a little bit, kind of some nuts and bolts stuff, Shane. I had this in the article. Livingston Hospital is a $38 million hospital, I guess, if that's the way you gauge them, in annual revenue. 172 employees. Now, when this really kicks in and where the rubber starts meeting the road on this, does that raise that? Do you project? Is there some way to project that going forward? And will it change the number of employees? And what does it do for your buying power? Does that give you more negotiation? I'm sure there's some, the consortium type buying power reduces your costs a lot of times, I guess.
It will. And, right now we're about salaries and benefits, a little over $10 million, is what we pay. It's a big employer, mm-hmm. and we expect that to grow as we grow services. We're going to hire more people. We're going to have more physicians, come in, nurses and all that stuff. And we expect that to grow. As far as the buying power, we're going to tap into, some of Deaconess. That's another, great thing about this affiliation. They can buy CT a lot cheaper than we can buy CT at Livingston County because they buy a lot more than we do. And it's everything. They buy a lot more, and they've got 11 hospitals. So
what is CT? I'm not familiar.
A CAT scanner.
Just CT scanner.
CT scanner. Yes.
So I don't know if that was tape or bandages. Or, okay. You mean the big equipment?
The big equipment. Yeah, but
you don't buy those very often.
No, we don't.
You thank goodness.
Yes. But just things like that, we'll be able to tap into their resources, and they've got people that can negotiate those things and have more clout than what we have, just as a standalone, facility. So,
now, do you see the operating room being upgraded and the emergency room and all that? I mean, all that's coming.
And down the road, what we're looking at is what we're going to call this. I think what we decided today is a modernization. We're going to modernize what we have, and also plan on adding some new square footage to the hospital. That's we've got. We told our employees, and they've met with an architect. Our board's been very proactive in this, and they've got an architect on board that's going to start looking at how we can use the space we currently have, and also we've got a build for the future and growth that we've got coming up. So we expect a lot of exciting things down at Livingston.
Now, it's my understanding. I think you mentioned we talked about it in the article in the paper as well. But you're going to keep your same board of directors. You're going to have, I mean, you're the CEO. They're not running you out of town and using their administrators.
Hope not.
You're going to have same leadership, same people. No changes in staffing or anything like that. But going forward, they're going to have some presence on your board, right? How's that going to work? You know, one of you guys explain.
Well, they'll have 3 board members. We have 12, so they're gonna come in with 3. I talked to the board chair at Farley Hospital, and we got started on this, and I asked him, I said,
And that's another of their affiliates.
that's one that they kind of brought out of, it was just about gone, and now have a new hospital, might as well say, but, and he said, they are great partners. He said, your board will be running, you'll have your same board meetings and things come up, you'll be doing that. But they're there to help guide you and help, if there's something that comes up, that's a bigger project or something there that we don't really understand, and Shane would have to dig it up for us, they're sitting there with expertise already in their minds that they can add to that. And we're not sure exactly who those will be. I do know one of them, and he's one of the main men up there. They don't just, that's what he told me too, he said they don't just send somebody to be there. It's the main people from Deaconess that comes down to your board meetings. And it's possible, I think, that we may even have someone from Louisville Baptist be down there on our board. So it's going to be exciting, to have, along with Steve, that's going to add a lot of expertise on the board that give us a lot of good things to look toward the future.
I can only imagine. I mean, again, you have a wonderful board, but a lot of these groups and businesses, public entities like that in rural areas, to get a board with a broad base of knowledge, sometimes it's kind of difficult. And then you have the opportunity to put people who do this for a living every day on your board, where you just have community members. But then they don't have a majority, so you can still kind of direct this the way you want. But what a great opportunity it is for that. I want to talk a little bit about some of the designation for hospitals. Hospitals, I think, since 2005, across the nation, we have lost over 200 rural hospitals, and I think right now in Kentucky, the figure that I looked up for the article, I think it was 28 are considered at risk right now. So obviously it's troubled times for hospitals. We've known that. We've talked about it. It's been in the news for quite some time. But there's a difference in Livingston County is a critical access hospital. Here in Crittenden, for instance, and Caldwell County is a critical access hospital. But in Crittenden, it has a different designation. Talk a little bit about the benefit of being that critical access and what makes it different.
Okay. Back in the late 90s, the government realized they were going to lose a lot of the rural hospitals just because they just couldn't produce the revenue and the volume to sustain themselves. And so they started a hospital could designate as a critical access hospital. Now it's limited. You could only have 25 beds. It was really about the only limit. So most of these hospitals are running low census, so a lot of the area hospitals converted, which Livingston County at that time chose to give up some beds. They were probably licensed for 50, I'm not sure, but they gave up 25 beds, and really what that does in simplistic terms, a PPS hospital, let's say we get $1,500 a day.
And PPS, what is that acronym for?
Perspective Payment System.
Okay.
So
and
what
that's what Crittenden is.
That is what Crittenden is, yes.
And other hospitals across the state.
Yeah, but in simplistic forms, being cost-based reimbursed, let's say both hospitals get $1,500 a day for a patient in the bed, and then we go out and say we build a new facility. Well, since we're cost-based reimbursed, we can capture the for every Medicare or Medicaid patient we have, whatever that percentage is, we get our depreciation, our interest off of our loan, off our debt, flows back through what we call a cost report. So our, $1,500 a day all of a sudden may go up to $7,000 a day, and that's how the government, put that program in place to help rural hospitals be able to renovate their facilities and try to keep up with technology, was be able to capture that cost-based reimbursement. And unfortunately, it's tough for small hospitals that aren't critical access, to survive because they don't get that. If they spend that money, they've got to increase their revenues to make those payments. So,
I guess in closing now, I'd like for you to just kind of describe the physical characteristics of the hospital. You talked about beds and employees, doctor. I mean, tell us your staff, your physician staff, maybe just by name on those guys and anything, or guys and women, I guess. Anything else that would be characteristic of the hospital?
Okay. Well, just first thing on our staff, man, we've got an awesome staff, and that's why Deaconess is here. They're here because we've got an awesome medical staff, and we got an awesome staff of employees that have always given good quality care. And that Deaconess knew that. Barry and I've joked they know us probably better than we know ourselves because they've done their homework. And we went up there one day and they had all our stats laid up there, and some of it was a little shocking to us, but to see where our patients go. So we've got a great staff, and you've got Dr. Barnes, Dr. Yaji, Dr. Patton, Dr. Guyette, as physicians kind of on staff that really do a lot for our hospital and huge supporters, and they've got that hospital at heart. And in the article we talked about, they've been behind this project 100% and from day one because they want to see that hospital there for years to come. But we're critical access, like we said. We're a 25-bed facility. We have an very active surgery department, radiology department, lab, respiratory. But that's where we're at now. And in the future, we want to be, as Barry said, we want to have oncology. We want to have infusion, and we just want to grow our business. As Deaconess can help get us those specialists and provide those services to local, citizens. So.
Well, it's certainly exciting times for the healthcare services in the area, obviously, and it just helps continue to keep our rural way of life viable. And if you look at the U.S. Census in Kentucky, Louisville and Lexington are growing, and the rural areas are losing population, and a lot of it has to do with losing services. You can't get the things you need, and healthcare being tantamount to that. For particularly those of us who are aging a little bit, it's important to have that. So thank you both. A wonderful opportunity to get a little more insight into that. It's always good to hear it straight from the old horse's mouth, you might say. But we also appreciate our sponsors, Farmers Bank and Trust, and Boyd's Funeral Home down in Salem. Boyd's funeral directors and cremation services since 1902, and of course Andy Fox down there is on your board, and we appreciate all that our partners do for us in helping bring important news to the community like this. Again, thank you, Shane, and thank you, Barry.
Thank you,
Thanks
Chris.
for having us.